Let me do another episode before the week goes out because there's never a right time. But if you guys notice, I'm really looking to the side because I have some points. I need to stay on point so I don't ramble. So this we're talking about why I opened my own clinic, right? From NP to CEO. So what is the drive? What is the drive? Because I know I have some colleagues out there, fellow NPs who, like me, struggle to take that leap, right? It took me what, 5 years to finally decide to step out and open my own clinic. 5 years. And this is with me having the desire to open my own clinic before I even graduated from NP school, right? So I know I was not alone. I'm not alone, right? And I know there are other NPs out there who are struggling. They're thinking about it. They're not sure if they should do it or not. But I hope this my videos will motivate you guys, right? Inspire, motivate, and hopefully you'll grow. Take that leap and grow in your personal life, your career, whatever it is you're trying or have ever wanted to do and not being able to take that boldness and do it. This is for you, right? So let's get to it, right? So Shepreneur again, my own a weight loss wellness clinic. Right now we're going on 2 months in, so that's why I really want to document so whoever follows it can see the journey, right? So far, 2 months recap. Like I mentioned last time, I see VA veterans do assessments, so that has helped as far as generating income while waiting for my weight loss part of the clinic to kick off. And also doing the veteran weight loss thing also brings traffic. But so far I've had overall in 2 months 4 weight loss patients, right? And I have not done any advertising. I know most people will say before you even open advertise, it all depends on your budget, right? There's so many routes we can all take and you see what works for you. I cannot say what everyone should do, but I will tell you what I have done or will do. The plan is to eventually start advertising once I can get my SOPs in line. With the few patients I have, that has really helped me to get a certain how do you say um, movement in the clinic from when a patient comes in, or first of all getting my EMRs in check to get them registered so they can self-register, get forms to them, they can sign it, I can check it, make it like streamlined before I get too busy. I'm trying to really get everything streamlined. So but let's get back on topic for today, from NP to CEO. So what motivated me to do this after 5 years? And I was like, okay, if I'm recertifying, renewing my license, I should be renewing it in my own space, right? Just, I kind of, the first thing was I got personally tired. I wouldn't say tired. Like I wasn't enjoying the care I was providing, right? To where, the timing, you have to be quick, 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 and even quicker each time. So it's like, if it's not 20 minutes, it's 15 minutes, and it gets even shorter. And then you get all the incentive to be even faster. And then at some point I started feeling like this is not why I became an NP, right? Not that I want to spend 2 hours with a patient, but you have those that come in and they're ready to go, and you have some that need some attention, and it just feels good sometimes if you can grant some other person who needs that time. But we know the system for all of us NPs working out there. It doesn't matter if you spend 2 minutes with one, you still got to spend the 15 minutes that they want you to spend for the next one, right? You're never fast enough. So I personally never felt like I was helping anyone. you know After moving around different specialties, they all kind of seem kind of the same. The process, I mean, it's a business, they gotta make money, but um, you always get to the point where you're like, well, I'm sure I can still make money just paying a little bit more attention to the patient rather than just getting them, rushing them in and out. So that was me. I came to a point where I wasn't really excited about going to work, which if you guys follow my channel, I will talk about my other business, which is owning an event center, an event venue, which we'll talk about that on another video. I had to start that business just to, it's like a distressor, right? Doing something other than medical. And that business is going on for 2 years, but we'll talk about that. Still ongoing. But for the clinic part that we're talking about today, so that was one of my reasons. I didn't feel like I was helping the patient like I wanted to. Everything was just on time, move in and out. And, some days I was just more, I felt worse based on the service I provided versus what I actually, because of the timing. To me, at least that's me. I don't know about everybody out there, but that was just me. So I felt like, okay, it's time for me to go do my own thing. So that was one of my motivation, right? So because for me, again, working as a floor nurse, there are things that I saw that encouraged me to be a nurse practitioner. And then when I became a nurse practitioner, I still felt like, man, I still was not able to provide that care that I wanted to, which for in most cases for me was to help prevent versus just providing medications per se. So another thing I'll encourage NPs out there is when you first graduate, again, if you have all the knowledge to start your own, by all means, right? I mean, a lot of everything we learn, even the MDs, whoever, we all learn. Nobody's born with any knowledge. We learn it. We read, we study, we learn it, right? So, but I encourage you as an NP, get a job, move around multiple places. Don't get experience in different places. That's how you can really tell where you belong, or what excites you, what you feel you can do for a long time and not feel like you're just going through the motion, right? But actually helping people, providing that service that you went to school for. So that's my why, that I decided to start my own clinic. Another thing I saw was also the gap in medicine. Again, just I took care of very chronically ill patients, right? Diabetes, high blood pressure, cholesterol, the metabolic syndrome that we have, and and other illnesses. Took care of cancer patient, hospice patients. So I saw them when they had surgery, came and went home, and some that I took care of until they passed away. But I always wonder, in a place where there's so much technology, so much innovation, why is there nothing to prevent? Why? I mean, we can't fix everybody, but I just felt like there's a little more we could do where it could help patients not go from that, you know, pre-diabetic, diabetic, and then we have the neuropathy. I mean, it seemed to only get worse most cases, right? And then the amputations and everything. I was always curious, like, what is it that we can do? Prevention versus just managing. Which was another reason I did the NP. I went for my NP program, family practice, because I wanted to do different things. So if you are also a nurse trying to figure out what you want to do, and you are someone who easily gets bored doing the same thing again and again, family nurse practitioner is my recommendation, just because you can really diversify and do work in so many specialties versus just one, depending on all the other certification or specialties that are out there. um, so that was a gap I saw, that we're always trying to put band-aids versus actually trying to find the core cause of the problem and preventing. I know all these diagnostics we're supposed to do. I know the food is always the problem, one of the problems, but I just feel like, well, I want to know more about how to help people not get to that bad state that most of my patients were. um, and then let's talk about now. I'm going to go from the gap, which is why I choose weight loss wellness, to the challenge of starting my own practice, right? Which, again, I wouldn't say it was a challenge per se. It was more like really deciding on opening it, right? Because after working different specialties, so I did urgent care, pain management, chronic, post-acute, motor vehicle. So I did all of that. The family practice, home visits. In 5 years, I did all those specialties, right? Um, I know there's more. There's endocrinology, all the other different aspect that anybody could do out there. But those are my experience, and I noticed one thing in common. Like most of the chronic illnesses were related to obesity. Most of them, not all, but most of them. So then it piqued my interest to study more about the weight loss and wellness. So again, if you find something that you love, I say don't just go with the typical what everybody else is doing. Learn a little more that you can help better the life of your patients, right? Because that's what we're trying to do, better the life of the people we take care of or we treat each and every day, right? So that was me. The challenge was really to just pick pick what it is I am passionate about, that I want to do day in, day out, and not feel like, you know, I'm just, stressing out, or, but that's how I pick weight loss wellness. And as far as the clinic, what do I have as far as my vision? Well, is to be, I'm cash based, so my weight loss wellness clinic is cash based. So for that already, I know I will have time for my patient, right? I know nothing wrong with insurance. People have their insurance, but I notice most times, because the insurance typically almost tells you what to do, right? And you and then the pay and all that, you turn to need to see so many patients in order to make any profit. So um, and also knowing that weight loss is not something that is really covered by most insurance, only if you have like really abnormal numbers. But we're trying to prevent, so we don't want people to get to abnormal numbers before we treat them. So that is why, again, cash based only. And if you're thinking of opening your practice, you can do whichever option that works for you. And that also will help give me time to really, teach, talk to my patients, teach them, encourage them, just that. I mean, nowadays, well, everything is so quick, right? So when you have that time to really, pay attention to someone and teach them, it really helps, because like I've had a patient already who, one of the complaint was, well, the other place I was with, they're so busy, packed with patient, they didn't even provide teaching. Again, I have patients that don't pay attention, right? They don't pay attention when you're teaching them. But that was one of the complaints, and that's how they became my patient. So you want to provide service different from everybody else. Um, so yes, from NP to CEO, that's what we're doing here. Providing that care that I've always wanted. So it feels very, very rewarding personally. So another thing I'll encourage you out there wanting to also take a leap and open your own business. Don't, how do I say? I know sometimes we want it super, super duper fancy. That costs money. Well, find an affordable place, right? Not too big, not too small. A room, you have your reception area, where your patients can sit. If there's one or two, a room or two, so that way your rent will be low, and you can get you little nice stuff, not super expensive, where you're not like drowning in debt before you even see your first patient, so that way you're not stressed out. So for me, the place, which eventually I'll show you guys, it's simple, it's affordable, right? And I don't have to stress too much, like as far as paying, because you always gotta be mindful, rent, light bill, water bill, all those bills that comes with it, the insurance for the practice, um what else, insurance for the practice, depending on if you have an because I already hired a medical assistant, because I needed one with my load with the VA assessment. So that has really been helpful, but you have to think of that too, to pay, and you need somebody to answer the phone and all that. You can do it yourself when you start, depending on what you have going on, but again, you don't want to start feeling burnt out, overstressed out from the beginning, because then you almost kind of regret doing it. Because that's just, I mean, you can have all the passions in the world, but if you're not organized, or you're just brain loading with all the things you have to do, you will get burnt out as possible, and then you would not like what it is you're trying to build. And the goal is to build long term, right? The goal is to build long term. So yes, my vision is to grow eventually bigger and bigger and bigger. And yeah, soon we'll start advertising once we get all our system in a row, which again, I think starting next month or before the year ends, we're gonna throw out, because again, January is coming where everybody's doing weight loss, so we're gonna start advertising pretty soon here. Because I think I have a good system in place. Might not have it all perfect, but I think so far I have a good system in place. And yes, you guys comment, like, subscribe. Let me know if you have any specific questions that is medical related. And I promise I'll get back to answering. I will not answer when you want that in time for you, but I will answer. Just trying to make sure I don't lose all this fresh thought process while it's happening, to share with someone out there who needs it, right? Let's see what other thing. Let's see, encouragement. Just want to encourage you guys, right? You can do it. If you're a nurse practitioner, girl, man, woman, young, old, it's never too late, right? You can do it. You just gotta, you know, trust yourself, believe in yourself. Just the same way the people who hire you trust you to leave their clinic in your hands, you can control your own clinic, okay? You can, and all the experience you've gathered so far is enough for you to start, depending on what it is you're trying to get into. I also took some online courses to help also to kind of really get a good knowledge of what it is I'm trying to, the service I'm trying to provide as far as weight loss wellness, and I'll recommend Justin Allen, Elite NP. His program has really been very, 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 very beneficial to me. So, and he has a lot of different courses on his website, elitenp.com. And if you want to embark on the journey and you feel like, man, I'm not ready, what system to have, his courses have a good amount of information that will help you get started. Right. So, but always, even when you read a book, it's different from when you actually do it. Right. And also reaching out to someone who is actually doing it. Right. So I'm here for that. If you have those questions that I can help you with, share this video with other NPs who are starting. Let me know what topics you guys want me to talk about. I have a list of topics that I'm going to be talking about just to stay on track. But I really want this process of documenting my journey, owning a clinic, to be a blessing to someone else out there, and encourage someone out there, right? Because I know, like, nowadays with all the layoffs and everything, you really can realize there's no, working for others, there's no guarantee. There's no guarantee, because things happen and you can be the one that gets laid off, right? But if you own your own, again, there will be those ups and downs. That's why when you start that business, make sure you're saving money, you're putting stuff aside for those rainy days, because I know most of the time when we work for other people, we're just trusting those paychecks that they're gonna come, right? But what if you get fired, right? Well, they ain't coming, and all that you're gonna hear is sorry. But if you have your own thing, you can figure out a way to generate some income somehow. But again, let's work on saving money, save and for those rainy days, if you're someone out there working for others, in other people's businesses. Nothing wrong with that. Not all of us are meant to be business owners, right? Not all of us are meant to run businesses. But if you are working for someone, make sure you're saving. Don't just trust that every 2 weeks you're gonna get a check. because seasons like this that we're in right now, with people losing their jobs, even those working in places where they thought they were never, that would have never happened, right? They're experiencing it, and the prayer is that everything will go back to normal, that they can take care of their families, right? Because that's not something you wish on on anyone ever. But guys, thanks for watching. Lives for me is better because editing is not something I enjoy doing. But I will try to do the lives, and hopefully, whenever you guys come in contact with the video, it will be a blessing to you watching it. So, thank you all for watching. Shepreneur here. See you all in my next video. Stay blessed. Remember to be kind. Bye bye.